all systems in our bodies are interconnected, completely interconnected. So moving bones and muscles actually can affect immune system.
Absolutely.
And feeling of pain, and this feeling is in our brain. So all these systems are so interconnected. We cannot find one target and target something. By targeting one molecule, we will target everything in the body.
Today, I have an incredible guest that is going to share with you some of the cutting-edge science and research that's happening in genomics and regulation and processes in the living cell. Today, I have Dr. Nathanson. Dr. Nathanson, thank you so much for being here with me today.
Thank you for having me.
Absolutely. Well, I have a million questions for you. Genomics is such a hot topic right now. It is something that we are looking at in sports medicine, that we're looking in performance enhancement, but definitely it is a cutting edge leg of research that we're seeing in chronic disease. And so can you tell me a little bit about how you got into this field of science?
It just happened.
And you're humble. I forgot to say, you're incredibly humble.
No. Many things in my life just happened. Probably it was destiny. So yes, genomics is developing very quickly. But I would say when we are talking, to be more precise, when we're talking about genomics, it means we're talking about sequence of our DNA. But there are other things that can influence our metabolism and our health or disease a lot. This is what we call epigenetics. And epigenetics, it is not sequence of our DNA. I mean, sequence of our DNA is something that we have in our cells. We cannot change it.
So it's stationary.
Yes.
And that's
yes,
it. And
yes.
then is that the science of genomics then?
It is library of cookbooks.
Ooh, okay.
Library of
I like
cookbooks to cook everything that happens in our cells. But let's say when you copy recipe from cookbook and you are going to your kitchen to cook, you can change this recipe.
Yes.
So there are epigenetics is exactly changing this recipe. Because we have some DNA sequence, because we have some mutations, it does not mean that we destined to have diseases.
Got it. So is epigenetics like the turning on and off?
It is turning on and off. It is also making stronger or weaker.
Okay. So if a person has, that was a big one for me. All of a sudden my brain went.
1 second. To be exact, there are few diseases, single gene disorders that, if there is mutation in some gene, it is disease. It is like sickle cell anemia or cystic fibrosis. But it is very few diseases like this.
Okay.
Majority of our diseases, including chronic diseases, including myalgic encephalomyelitis and many other diseases, it is not just mutation in one gene. And many other diseases can be changed by our lifestyle, which is epigenetics.
So that brings me to this question, which is totally throwing me for a little bit of a curveball, but I'm excited about it. So I always thought that there were a handful of genetic caused diseases, right? Like you mentioned, sickle cell anemia, but that the chronic diseases like inflammatory response, chronic fatigue syndrome, even chronic diseases like maybe chronic diabetic patient, there is a genetic or an epigenetic component to that?
There is a huge epigenetic component like that. And let's say our nurses practitioners, they change epigenetics in their patients. So they do blood tests.
Hold on.
Yes.
That was profound. I'm sorry. I know this is what you study every day. You're a leading expert in this. You're too humble to say that. I will say that. We all will say that. But I don't know if my mind's the only person whose mind is blown right now. But I think so many times People think that, well, you ate too much sugar, you have diabetes, or you got a toxic exposure. But I love that you just gave us the knowledge base that there is a turning on of a genetic expression that allows that disease to actually manifest in your body.
Yes.
And what we see, because we do translational research, which then goes into the clinic setting, is you guys are testing and showing that we can actually turn that back off.
Yes.
That's
yes, and
She says
exactly. This what is done by, let's say, Dr. Violet Reneska, Dr. Irina Rosenfeld.
Yes.
They change epigenetics. They turn off metabolic reactions that lead to disease, and they turn on metabolic reactions, proteins, everything that leads to health. This is exactly epigenetics. This disease, it is multigenic, and yes, there is genetic component probably, and it is change. There are changes. We don't know yet what is this genetic component, and sometimes it is frustrating, but we cannot find it yet. I hope we will, but not yet. So
can you share
even if there is this genetic component, but this component can be either overruled completely or at least partially to make this disease easier, to
mitigate
if
symptoms?
not to reverse it, but at least to mitigate symptoms to some degree.
Great.
Yeah.
Okay, that's amazing. I mean, by the way, that's incredible, because I think so many times we go into a doctor's office or we are just struggling with symptoms, and we don't always understand that there are things that can alter that. I mean, we as an institute, we're very integrative medicine, whole body mindset, right? We know that food and nutrition and environment and environmental exposures
and thinking
and thinking and the mind, and the mind make a tremendous impact on the health. I had not made the connection to that, and I know that that's your area of specialty and research. Will you share with us, with the community, some of the research that's currently going on in chronic disease, chronic inflammation with epigenetics?
Epigenetics, it is a lot of different reactions. So, well, again, problem is research is very expensive.
Yes.
And I can do only research for which I get funds.
Yes.
There is, so for myalgic encephalomyelitis, chronic fatigue syndrome, we did some work in area of methylation of DNA and area of some non-coding RNAs. And we did see difference between patients and healthy controls. Also, we could see if blood was drawn from patients after overnight fasting or after breakfast, it also could change what we see in blood. There is kind of sister disease, which is Gulf War illness.
Yes.
Which has.
Can you explain that disease to me, to
so
our community?
In 1990, 1991, first Gulf War.
Yes.
About 800 American troops were deployed to Kuwait.
Yes.
It was the very first Gulf War. And American soldiers did not have much of direct combat, but they were exposed to a lot of environmental hazards.
Was that like
their uniform was soaked in pesticides. Their camps were located above underground storage of radioactive materials. They were exposed to low dosage of sarin. So it was a lot of factors. And about between 25 to 30% of them came back ill. And symptoms of this illness are very similar to symptoms of, let's say, myalgic encephalomyelitis, chronic fatigue syndrome. So I was getting funding from federal agencies on and off to do research in ME/CFS, and lately I have more funding to do research in Gulf War illness. So
So when you say similar, is there a neuroinflammatory response?
yes,
Okay. And the fatigue?
fatigue, neuroinflammatory response, gastrointestinal issues, cardiovascular issues. Symptoms are very similar.
Okay.
Clinical symptoms
Okay.
are very, very similar. I cannot say identical. I'm not medical doctor, so I would not say identical, but I know that very, very similar.
Right.
So I got funded to look at single immune cells in Gulf War illness patients. So this is an area of research that is, now it is cutting edge when we can look at every single cell. From blood, from lymphocytes, I can take about 5,000 cells, which represent different types of lymphocytes, and look what happens in each of these cells. And this gives a very good resolution of events, what is happening with the immune system, including epigenetic changes.
So the implication with patients, right? So we've got individuals that are dealing with this from a patient perspective. We at the Institute, one of our primary goals is to shorten the gap between a concept of how we could possibly help somebody, scientific research of what could possibly help somebody, and implementing treatment with this.
Yes.
When you are working like on a research project like that, is it in your mind always thinking about the body of whose blood that came from? Like, are we thinking about how we can then create an intervention?
So in the beginning, I learned not to think about body because when we're talking about research, it has to be technically valid
Yes.
and clean.
Yes.
So when I have samples from control subjects and from patients, I don't want to know where it came from because I have to treat all these samples exactly the same
Right.
way. I cannot
Getting rid of the
know-
emotional variable.
Yes,
We've got to
absolutely.
get rid of the emotional variable.
Yes, I have
Okay.
to focus exactly the same way on each sample.
Right.
Only then results will be valid.
Right.
And we need technically valid results. So what happens from patient perspective, it is at the later stages after we see what is happening on molecular level, and then we try to understand which metabolical pathways are changed. Then when we can think about patients.
And so then we look at what type of healing or help protocols we can implement.
Yes.
And is it a lot of, like you even brought in the mind, right? Is there a lifestyle modification that happens with?
Lifestyle modification can change a lot.
What about nutrition?
I think nutrition is included in lifestyle.
Yes.
Lifestyle including nutrition.
Wonderful.
Can change a lot, and this is those are these epigenetic changes. Yes. So let's say work like this at single cell level. I can see that. Well, for example, in our preliminary studies, we could see that patients with Gulf War illness have more monocytes than healthy controls. And I can convey this finding to doctors. I mean, not yet, it was just preliminary studies. Or let's say preliminary studies that I tried to do in order to receive federal funding in future involved about the same type of experiments with ME/CFS patients. And I could see that these patients that I had blood from, they have a lot of B cells, a lot.
So
From 3 to 5 times more than healthy controls. And I can tell about this I can tell our doctors about this.
And something to be aware of or something
Yes.
to look for. So
Yes.
we talk a lot about, as an institute, about believing the patient. And we have, and I talked to Dr. Arena today about that, about empathy for the patient and believing the patient. But I think there's the heart and the compassion and the passion that our practitioners have. but I really think it's grounded in such solid science that it's their belief or their hope for resolution or getting a patient better comes because we do this incredible research, right? We see it. It's like you said, it's validated.
Yes, I would say because we try to work together.
Yes. So in your body of research, because I know that there's a lot of different
Different essays.
yes.
Different experiments.
Yes, exactly. What kind of stands out most in? I'm gonna use the generic inflammatory response in the body. What is it that it's connected to the immune system? Is it that we're hearing so much about inflammation and what happens in the body with inflammation, and is there something that stands out to you? Is there any commonality that you're seeing in your research?
All systems in our bodies are interconnected, completely interconnected. So, okay, I'm working with lymphocytes because it's just easier to access lymphocytes. It is not as invasive as access of spinal fluid or anything else. But all systems are interconnected. If we change one system, if we change a little bit something in immune system, all other systems will be changed.
That's profound. I mean, I think I'm hearing that in our community, in our INIM
Yes.
community, is that everybody embraces that all systems are
Yes.
interconnected.
So we have Dr. Patrick Berry in
Yes.
the clinic, who is an osteopathic physician who is doing osteopathic manipulations. So it was found that patients just with chronic low back pain,
Okay.
they undergo osteopathic manipulations, meaning osteopathic physicians move their muscles and bones in low back.
Right.
But cytokines in their plasma also are changed after that.
Oh, wow.
So moving bones and muscles actually can affect immune system.
Absolutely.
And feeling of pain, and this feeling is in our brain. So all these systems are so interconnected. We cannot find one target and target something. By targeting one molecule, we will target everything in the body. And that's why I really like way that they do blood test and they try slowly, very, very gently, a little bit by a little bit, change diet, change supplements, but very, very carefully without these drastic
without disrupting the imbalance can be disrupting the imbalance can inhibit finding balance. Let me say that again. Disrupting an imbalance can be hard on the body to find a new balance or a healthier balance. So what we do at the Institute in a research perspective, what do you think sets us apart? I've heard people talk about our ability to do things quickly, to do things effectively. What do you feel like sets INIM's research program apart?
I think some of our clinicians that keep on open mind and constantly studying.
Okay. Is it that we're bringing the patient to the issue is becoming more defined, and so that defines the research, or is the research defining what we look for in the patient? I know they work together, exchange ideas. So it's the collaboration.
Yes.
It's the collaboration.
Yes.
That's
it is
wonderful.
Absolute collaboration. Yes. And people like them and some other people that try to work. So there are some people in the lab like Dr. Durasamy, who is doing a lot of work in the lab and trying to get all these tests valid and valid results. Yes, trustable results. So this makes...
So if I were to fast forward 10 years from now, and I were to say, what, and dream big, I always say, as if we got every grant and we got every donation that we desperately need, right? And we had the freedom to work as quickly as we could towards finding help and solutions for patients dealing with chronic fatigue, chronic illness, Gulf War injury. 10 years from now, what do you think is going to be cutting edge medicine from an epigenetics perspective? What's the dream out there?
I would love to be able for every patient to do this single cell research and to look at on the level of single cells at each patient and to see what is wrong with which types of cells. And then hopefully we'll have more knowledge about connection of nutrition and lifestyle with these metabolic changes. Well, I have to ask you another question.
Yes,
so how much money
you've unlimited funds, unlimited resources, unlimited funds.
Yes. So then I think research at single cell level for each patient. Actually, you know what? Problem is we don't even now. We don't quite know what is norm.
Wow. That's a very valid point. So we don't have a clear definition of health. Do you think? Like
we have very relative definition what is health. Okay, and here is something that I believe. Okay, let's say cholesterol values for different people, and I know that norm of cholesterol is 200 is.
Yeah, top. You want to be under
level.
200,
Yes.
they tell you. Yeah.
But I think that because bodies are different,
yes.
So for each person, this norm should be different.
Yes.
It is my vision. And again, I'm not medical doctor, but it is kind
but
of
all
what
of
I
our
believe.
medicine comes out of research scientists, just so we are clear. We practice medicine based on your research and the findings of research. I mean, there is some trial and error for sure. But we define our protocols based on what research says, whether it's a drug or an intervention or a nutraceutical, right? All of our sound big breakthroughs in medicine are through research. So I love that perspective. That perspective is so valuable because you come at it from a completely different aspect, for sure.
So probably it would be better to look at cells of the same person when person feels better.
Right.
And then when person feels worse, and probably this worse, try to move to better.
Yeah. And
Yes,
also
for each person.
taking an indicator, or if I'm hearing you correctly, it's not just the blood chemistry, it's how we feel, how mobile are we, how is our cognitive function, how much joy are we experiencing, right? And then if we could take the cell at peak level, our oxytocin's through the roof, and then we could take the cell when we feel worse and reverse engineer that. I love that aspect of medicine. That sounds fascinating to me.
Maybe not in the highest state, but just normal.
Oh, I want to be 110% all the time. Peak performance.
Quiet, calm. Yes, when it is comfortable, just
in a nice, healthy homeostasis.
Yes.
But that's a really good point. I genuinely never really thought about that, is what is normal. And when you bring the cholesterol issue up, I mean, we see women that are going through menopause that have a natural spike in cholesterol as the body's starting to change from the E1, E2 conversion.
And it could be absolutely normal.
Absolutely
from
normal.
My point of view.
Right.
And again, I'm not medical
You
doctor.
understand, yeah. But it's an interesting observation. And an interesting observation, too, when we see people that have, been on statin drugs and they still get tons of blockage. Why is their body that way and another body the different way? And looking at that customization.
I think that disclaimer is in order, that it is just talking. It is not even advised to do anything.
Of course
like this.
not. This is what science is it's the freedom to ponder, right? And to wonder. And that's where the best medical breakthroughs come through. And I will share that on the outside, or not being, a clinician and not being in the research space right now at the Institute, what I get to observe is how much latitude is given for people to think and to ponder and to wonder about things like this. And you've given me a lot to wonder about. I have a question, one last question.
Sure.
I would like to have an entire podcast on epigenetics. Would you come back and do that with me?
We can do it.
Okay, wonderful. I cannot thank you enough. This has been such an incredible experience. Our goal is to find, first, to give hope to individuals. And I think with us constantly holding out that we believe you, we believe in you, we believe in your body's ability to heal, we understand through research that you can move towards wellness, that's important for everybody out there to know that.
Well, they get patients that are housebound, almost housebound.
Right.
And if these patients follow their recommendations, so majority of these patients in a year or year and a half go back to work and even have babies. So yes,
it's
it
amazing.
is all changing
Yes.
epigenetics.
Yes, isn't that incredible? Well, thank you so much. And I know with complex diseases and chronic fatigue, ME, CFS, I always get that backwards. Chronic fatigue
CFS.
syndrome. Yes, Gulf War illness, all of these neuroinflammatory disorders, I know that we're working very diligently in research. And so my goal is that as we do this, we create the reality that we don't have barriers to do unlimited research so that the vision of customized care and, turning off those switches that are causing the manifestation of negative disease is available to incredible researchers like you. So thank you so much for coming. I really appreciate it. I'm inspired and excited. And I've got you for another podcast, right?
Okay.
Okay, great. Thank you.